The mission of the Maryland Center for Health Equity is to actually translate the science of medicine and public health into culturally tailored community-based interventions, and to take that into the neighborhoods where people are suffering from preventable illness and death.
The Maryland Center for Health Equity in the School of Public Health is committed to work in our communities. This focus is important because the disparities in health that are present in Prince George's County and throughout the state is a very important issue.
We are a collection of people, but the center as a whole also has individuals that are interested in a variety of kinds of research. So one of the examples is getting people in and getting them screened for colorectal cancer, for example. And so Dr. Thomas and Dr. Garza have been leading that effort out in our hair network, our barbers and beauty shops, to get people in and encourage them to get screening. And the nice thing about that project is that we know, number one, screening for colorectal cancer is actually enormously helpful in detecting it, and in fact can, with minor polyps found during a colonoscopy, can actually take care of those and reduce the risk dramatically. It's critically important to build trust before starting a research project. And I think that's one of the benefits of the Maryland Center for Health Equity and the fact that the National Institutes of Minority Health and Health Disparities recognize the importance of having community engagement and research and supports that.
We asked the community when we started off, both as a center, office, institute, what is it that you think we ought to be doing that we're not doing? Nobody understands that better than people like yourself, the people who are in the community, because you're experiencing these disparities that we talk about. You get people in here all the time, probably sitting in your chair, talking to you about the kinds of things that go on that we wouldn't even know about. But the fact that you're willing to do what you're doing and then talk to people like Dr. Thomas and some of the other folks, what happens with what you tell them is that they take that information back to their universities and to their laboratories. They convert that conversation into good science.
One of our programs is called the Mission of Mercy and Health Equity Festival. In this initiative, we literally transformed our basketball arena here at the University of Maryland in College Park into a free emergency dental clinic, where we set up 110 dental chairs, complete with oral surgery all the way to cleanings and endodontics. Over 1,000 people were served in this program. And we provided wraparound services in the area of cardiovascular disease and type 2 diabetes and issues like obesity.
I'm here because I do not have no Medicaid and I am not working, and they're here with free dental and free health, free care, so I come to get some help.
The elimination of racial and ethnic health disparities requires multiple disciplines. No one discipline has an answer. When we talk about disciplines, sometimes we forget the community. And so we cannot do anything without a partnership with the community and leveraging the relationships that communities can bring to the table. So we very clearly believe it's a two-way street. Not only do we build trust with the community, but once we hear the community's concerns, I think it's incumbent upon us also to bring their concerns back to the academy. And one of the things that we're learning when we interact with people in the community is that when they come into our healthcare delivery systems, when they come into our research projects, sometimes they're not treated with respect. And I think it's important for researchers and clinicians to understand that feedback coming from the community. It's important for us to give voice to their concerns as we attempt to help save lives.
We've had a long-standing relationship with the University of Maryland School of Public Health. They were part of our Blue Ribbon panel of experts when we were developing our center back in 2007. So we've had a lot of partnership with the faculty members here and have continued to partner with the center on outreach in the community. Particularly, we've partnered with them in the Mission of Mercy. It's the Mid-Maryland Mission of Mercy, which was a health equity festival and a free dental clinic for the community. And so our partnership here is really a testament to thinking about addressing health disparities and inequality, as well as promoting social justice.
So we launched our campaign. It's called HAIR, Health Advocates in Reach and Research. And we have a network of 10 barbershops and beauty salons here in the Maryland and Washington, D.C. area, where we're literally bringing clinicians and public health educators into these venues, into the barbershop, to actually raise awareness about age-appropriate screenings for cancer, providing health screenings for cardiovascular disease and type 2 diabetes, navigating people to smoking cessation programs. It's been hugely successful. We are conducting a number of studies in the barbershops right now, from issues around flu vaccine to actually colorectal cancer screening.
My father actually was a victim of the colorectal cancer that eventually killed him. This is for real. It's not a game. It affected me directly because of the relationship I had with my father, and to lose him was, I miss him, and I wouldn't want anybody to go through what I went through. So this information that we have here, I think is very vital, and it's going to, I just hope it changes people's lives.
Everyone comes to the barbershop. We have lawyers, doctors, senators, executives, trashmen, guys who work at, at Safeway and things of that nature. You have all different levels of, of people working and work fields. Many of us, especially in our black community, are missing a lot of information to stay healthy. And a lot of us are actually dying from things that could be prevented. They're going to train us, and we're going to train the community, one by one, in the chair.
We also use the barbershop as a venue to bring our basic science researchers into the community. We have a study going on right now where they're collecting DNA and mouth swabs to understand the microbiome of people who smoke. I think that what we've learned is that African Americans and Latinos are interested in research. They're willing to participate in research. Unfortunately, far too often they're never asked to participate. But what we've done by creating this infrastructure is increase the opportunity for them to actually have an opportunity to participate in research, and to bring researchers into those settings where they can learn to become more culturally competent, where they can learn to be more confident in their ability to reach African Americans and other minority groups in the community setting.